am Dr. MD Majeed Pasha, pulmonologist at Fortis Hospital, Nagarbhavi. Intervention pulmonology is a branch of pulmonology where we do minimally invasive procedures using certain tools, instruments like bronchoscopy, fluoroscopy, that is thoracoscopy, VATS, EBUS, and certain others. It will help the patient as these are minimally invasive procedures where surgery can be avoided, there will be no scars and less risk to the patients, and where we go and see and also do certain procedure and treatment. What we do at Fortis Hospital Nagarbhavi is whenever the patient comes with the pulmonology issues, we'll have an initial assessment from symptoms and signs to the basic evaluation, and then we'll have a clear idea that what patient is suffering. Most of them will have a common issues like asthma and COPD, and sometimes patient will be having some issues which will be treated most of the time like a common disease, but when we have a proper assessment, they will be requiring some of the procedures to diagnose whether it's just a common issue or it's a lung cancer or interstitial lung disease or anything like non-resolving pneumonias and all those things. For these kind of diseases, the intervention pulmonology tools like bronchoscopy is required, in which what we do is with the help of camera, with a minimally invasive procedure, we go to the lungs and we see what patient is suffering. Then if the patient is having nodules, nodes enlarged, then we do biopsy, we do bronchoalveolar lavage, then we'll have an accurate diagnosis. Gone are the days where we used to treat based on the assumptions and certain radiological things, and to diagnose the lung diseases, surgeries used to be done. So by using these tools like bronchoscopy, we can diagnose accurately with minimally invasive thing. And this is about the lungs. And outside the lungs, there is a pleura in which there can be certain diseases like infection in the pleura, that is pus in the pleura, empyema, and there are kind of cancers in the pleura and pleural fluid accumulation due to various other reasons. Most of the patients will be suffering with recurrent pleural effusion. They will be suffering with the repeated issues. So what we do is we do fluoroscopy. That is again same with the minimally invasive procedure. We diagnose what the patient is having in the pleura, and certain times it is required to do the biopsy. So we do the biopsy and accurately we diagnose whether the patient is having just an infection or it is something serious like cancers. So by this we treat the patient also. So by doing all these intervention pulmonology procedures with the minimally invasive way, so we avoid surgeries and the scars to the patient and the minimal suffering. And now these procedures can be done in the daycare also. So we in the Nagarbhavi Fortis, we are doing like with a minimum time and using the technology and tools in the short duration of time, we are diagnosing and treating, and also we are discharging on the same day also.